1 in like a half males to 1 female. Type 1 diabetes is genetically inherited, but you can also have a higher risk of getting type 2 diabetes. It's just down to genetics. Type 2 diabetes is more common in ethnic groups compared to non-minorities, unlike type 1, which is the opposite way around. Type 1 is more commonly found in children, while type 2 is commonly found in adults. Some symptoms of type 1 diabetes is you pee a lot, you're super thirsty, you can lose weight without trying, super hungry, you have blurry vision every now and then, you have numb or tingling hands or feet, feel very tired, have dry skin, sores, all that stuff. And then for type 2 diabetes, kind of the same.
And like, I know one of the worst case scenarios is, so like feet are a big thing with people who are diabetic, and as it gets poor, like if it gets really, really bad, I've actually known, he's actually a basketball coach, but he's had to have a foot amputated because of diabetes and complications caused with feet. So my dad's diabetic, and that was one thing his doctor was always like, and you have really nice feet, so not in a weird way, like, you are a diabetic person, you have nice feet.
When someone has type 1 diabetes, when they were born, they had a chance of getting it, but something in the environment fully caused it. A really good example is with identical twins. With identical twins, the genes are exactly the same, but when one gets it, it's not a 100% chance that the other twins will get it. Some treatment and equipment. Often with type 1 and type 2, the user has a pump that goes on their arms, legs, and stomachs, as well as a sensor that can detect when blood sugar levels are dropping or rising. And the pumps give insulin straight to the bloodstreams. With type 2, medications can be used, but the main way is with pumps. Prices for the equipment range from about $3,000 to $6,000 out of pocket for the pumps, sensors, and the insulin itself. But with insurance, it ranges from around hundreds.
And for my dad, he just takes a little shot. Like if we go
that's also one of the other methods that's used.
So if we go out to dinner, he kind of has a gauge now based on what he orders, and he just kind of puts this little knob and he sets it, and he shoots it right into his stomach. So.
Some famous people with diabetes is Nick Jonas, Tom Hanks, George Lucas, and James Earl Jones. And I myself, I have a cousin with diabetes. He is around 8 to 9 years old. When he was diagnosed with type 1 diabetes, he had to have pumps all the time. He had to take shots all the time. And it's really crazy how much like people with diabetes have to do. That seems crazy to us. Like he had, like Mr. Connell was saying, he has to take like 10 shots a day, depending on like snacks and lunch and dinner and breakfast and all that stuff. He has mood swings sometimes. Like if he has high blood pressure, not blood pressure, blood sugar, he'll get like headaches. But if he feels low, he'll feel really tired. He's still a super dorky, nerdy kid, but he plays football, soccer, and he's to be honest, one of my heroes. Plain and simple.